Thank you, sir. You know what? So after a lot of exciting lectures in the morning, poor me is entrapped with blepharitis. Um, this topic looks simple, though it's rather complicated as well. So you won't get any good account in the textbooks. So even I tried ChatGPT and Copilot. They are also a bit confused about the topic. And ultimately, I have to rely on the literature survey as well as the work I have done for last few years. The biggest problem with the blepharitis is you don't get the classic picture. You learn something in your textbooks and you see something else in your patients. Why? Are they not getting blepharitis, our patients? Are they different breed? No. They are getting, but probably in a different manner. So if you see the classic picture of the blepharitis, blepharitis is basically the inflammation of the eyelids giving rise to swollen, reddish, itchy, greasy, crusty eyelids with watery, blurry, irritative vision, the eye. And you can divide it to anterior blepharitis, posterior blepharitis, or the chronic blepharitis, whatever. The things. And just look at the causes, because I found it in my literature survey, might be interesting. You know, the exact cause of blepharitis is not yet known. Obviously, it's multifactorial, and there are some categories of causes that I have found. I have categorized it into infections, infestations, inflammatory, allergies, and trauma. Interesting thing, trauma, all type of traumas, physical, chemical, thermal. Mind you, thermal, the heat where we live in. And the toxicity, and there are some lot more, but I think this would give you some idea about the causes. And when you see, why are we not seeing the classic picture of blepharitis? So actually, I thought of these postulations, my postulations, I may be wrong. Our patients are much cleaner than what we think of. I mean, in European countries, some studies have shown during the winter, 30% of them are not washing their faces. It's quite different from our context here. And they may be ignoring the early signs, and they may be coming up with later signs, chronic signs. Allergic conjunctivitis is much more common than what we think, because we are living in a pool of allergen at the moment in Sri Lanka. And the mighty sun. That's something we need to think of. Anyway, we will see some presentations of blepharitis which are not very common. The first thing that I have found is dry eye disease. Blepharitis can give rise to meibomian gland dysfunctions, well-known fact. And meibomian gland dysfunction can in turn cause blepharitis. And two together will lead to dry eye diseases. And you know, there are different entities. The dry eye syndrome is another entity. Those diseases will share common symptoms, and sometimes it's difficult to differentiate from each other. There are some diagnostic dilemmas. Recurrent chalacia. So that's also a presentation of blepharitis. In elderly people, especially elderly females, we think of carcinomas, especially sebaceous cell carcinomas. But in younger people, if you are coming with chalacia over and over again, please find another cause. Could be blepharitis hidden. Until you treat it, the patient is not going to be very happy. Chronic allergic conjunctivitis, the two entities will share some of the symptoms, itching, irritation, pinky eye, whatever. And what I have found, and what I have found in the literature as well, the chronic allergic conjunctivitis will come first. So after some time, it will turn into chronic blepharitis. And until you treat the blepharitis part, that patient is not going to recover. They will be coming up over and over again to you. Interestingly, I have found frequent blinking, especially in young people, kids. The frequent blinking in kids is a difficult thing to manage. So they blink for every reason. Psychogenic mostly, or other complaints. Blepharitis is one of things. Actually, I have seen a couple of patients with this thing. So after treatment, they got better. The other common thing is allergic conjunctivitis that we are going to miss in patients with frequent blinking. Eyelash-related problems, okay? They might come up with these things. Trichiasis, misdirected eyelashes. Distichiasis, di means two, stekos means rows, the two rows. Where does the other row come from? The meibomian glands. chronic inflammation will turn the meibomian glands into a pilosebaceous unit. So this is distichiasis. Meadows mean bold, so bold eyelids, madarosis. And polys means gray. It's not white. Polys originally means gray, so grayish eyelashes are called poliosis. I mean, a lot other causes will give you these conditions. The blepharitis is just one of them. Corneal ulcers, not very common, but you do get corneal ulcers following chronic blepharitis. Usually it's an immune-mediated reaction rather than the organism going itself and infecting in the eye. So the characteristic things are, they are below the pupil level, bottom part of the eyelid, and along the lid, lid closure. So there's a line. It occurs along that line, but it could be anywhere as well. Carcinoma of the lids, because usually blepharitis gives rise to crusty lids, but there are no blood. So if there's a blood stain, please be careful. You could be dealing with a sinister thing. And there are rare occasions where blepharitis itself can cause a lot of ulceration in the lids, but it's very rare. Remember, rare things are rare, common things are common. So if you get ulcerations in the lids with the blood-stained crusty things, you must be dealing with some carcinoma. And be careful with the lid notching. I think you must have observed in chronic blepharitis, there are tiny, tiny notches occur along the lid margin. So in the carcinomas as well, you can get the same picture. Interesting thing, luckily not in Sri Lanka. So there are reported cases, people do get stress, anxiety disorder, and even depression with blepharitis. We are very lucky to live in Sri Lanka. So if I'm having some irritation, today itself I can go and meet the best doctor, eye surgeon, and get the treatment. In some countries, especially European countries, if you ring the secretary and tell that I'm having a little irritation, they will ask, how is your vision? My vision is good, come in 10 months or 15 months in that case. People do get problems. They are living alone, so they are depressed. So adding this irritation for a long time can cause to mental problems. So not in Sri Lanka, but those are not, proven things I got through in my literature survey. So case reports may be having, we might have to think something about it as well in time to come. Well, that's the basic things I have found. There are small things, but I thought this would be interesting to share with. And just a few things about the treatment of blepharitis. Treating the root cause is very important, otherwise it won't go away. In general, lid hygiene and warm compression. Indian people are doing a lot of studies on this. For the lid hygiene, now they have come up with this tea tree shampoo. The tea tree shampoo they are calling it. It's available in India. So I found some, I have discussed with some guy in India in this AIO meeting. So they are providing this tea tree shampoo to wash the lids. Antibiotics for the treatment, you need accordingly. And anti-inflammatories, you need some steroids as well to cool down the lids. Omega-3 fatty acids to improve the function of meibomian glands, because meibomian gland function is also very important in this scenario. Immunomodulators, in some cases, rare, but still it could be handy. And the new thing is intense pulse light therapy. So it's available in India. We don't have it. It's been used by dermatologists for a long time, but now it's available for the treatment of blepharitis. That's basically it. I just want to share some take-home messages. So like its multifactorial origin, blepharitis can be multifaceted, can have multifaceted presentations. So we need to find it out for the treatment. And please look at the lids. It takes a few seconds to look at the lid and lid margin in each and every patient, because there could be written stories. Thank you very much. And I thank Dr. Amila for giving me opportunity.